Statins and niacin for cholesterol control. Statins and niacin are two indispensable things in the treatment and control of cholesterol. There is such a thing as bad cholesterol. Good cholesterol is actually important for heart health. The key, as with all aspects of health, is balance. Another name for bad cholesterol is low-density lipoprotein, LDL. Good cholesterol is known as high-density lipoprotein, HDL. When your LDL cholesterol level is high, you might need medical treatment in the form of statins. However, due to the possible side effects, you may also be wondering about alternative treatments, such as niacin, vitamin B3. Statins and niacin await those with high cholesterol. There are a variety of causes that can lead to high cholesterol. Some of these are out of our control and determined by genetics, and some are lifestyle choices that we can change. Different factors that can cause or increase your risk of high cholesterol include having a family history of high cholesterol, lack of exercise, being obese, smoking, having other illnesses such as diabetes, eating an unhealthy diet high in unsaturated fats and cholesterol, taking certain medications, including steroids and progestin. Age. As you get older, your cholesterol level tends to rise. Gender. LDL cholesterol rises more easily in women, though they tend to have lower bad cholesterol until around the age of 55. Too much LDL cholesterol can increase your risk for heart disease. At the same time, too little HDL cholesterol can lead to the same effect. This is because HDL is responsible for removing bad cholesterol from the blood and bringing it back to the liver for processing, preventing the accumulation of plaque in the arteries. According to the National Institutes of Health, your ideal cholesterol levels are: total cholesterol, less than 200 mg per deciliter. LDL cholesterol, less than 100 mg per deciliter. HDL cholesterol, 60 mg per deciliter or higher. Control LDL cholesterol with statins. Contrary to popular belief, high cholesterol isn't caused by poor dietary choices alone. In fact, cholesterol is made in the liver. From there, it is circulated throughout the rest of the body. Therefore, it can be problematic if your liver produces too much cholesterol. In such cases, a healthy diet and regular exercise won't be enough to control your levels. So, you may need statins, otherwise known as reductase inhibitors, to balance the problem. Statins block the enzyme that the liver uses to make cholesterol. At the same time, statins help lower LDL cholesterol. They do not raise heart-healthy HDL cholesterol. Also, another benefit of statins is their ability to eliminate arterial cholesterol buildup. This may reduce the risk of a heart attack, which is why statins are often prescribed to those with a high risk of heart disease. Examples of statins include atorvastatin, Lipitor, simvastatin, Zoca, fluvastatin, Lescal, Lescal XL, lovastatin, Mevacor, Altopref. Certain groups of patients are more likely to be prescribed statins than others. Women are less likely to be prescribed statins than men. Specifically, the four groups most likely to be prescribed statins are people who already have heart disease, people 40 to 75 years old with type 2 diabetes, or people 40 to 75 years old who have a high risk of 10-year heart disease, people with an exceptionally high level of LDL cholesterol. Utilizing statins are often considered to be a lifetime commitment. In many cases, you'll have to make intense and substantial lifestyle changes in order to no longer need the medication to lower your cholesterol. Cholesterol levels will increase if you stop taking the medication, keeping you on it indefinitely in many cases. Raise HDL cholesterol with niacin. Normally, niacin is derived from foods like chicken and tuna. It helps your body use energy from food as well as promotes healthy eyes, hair, and skin. Moreover, it also supports good digestion and your nervous system. Niacin is most commonly used in people who have high cholesterol but can't take statins. However, niacin should not be used by people with liver disease, stomach ulcers, or active bleeding. It is sometimes used in people who have already had a heart attack. Doctors are currently debating whether niacin should be used in patients who have a high risk of heart disease. Niacin can also be used to boost your HDL cholesterol levels and decrease your levels of triglycerides. Triglycerides is a type of fat that increases your risk of heart disease. The Mayo Clinic estimates that taking niacin supplements can increase HDL cholesterol levels by 30% or more. However, the amount of niacin needed to have this effect is much higher than the amount normally found in the diet. At these high levels, there can be some undesirable side effects. So be sure to talk to your doctor before beginning to take high doses of niacin. Niacin is widely available in vitamin stores, as well as in the supplement section of drugstores. Some doctors recommend prescription forms for those who may benefit from high doses. Using more than one. It is common for doctors to prescribe more than one cholesterol medication. For instance, statins are sometimes taken with bile acid binding resins to help lower triglyceride levels. To date, niacin is the only supplement that shows real promise in helping cholesterol. But it can't decrease LDL cholesterol like statins can. Niacin is the preferable choice only if conventional medications aren't well tolerated. The jury is out when it comes to combining statins with niacin. It can be dangerous. Meanwhile, the Mayo Clinic reports that there is no evidence that the combination of statin and niacin is beneficial. In April 2016, the Food and Drug Administration (FDA) rescinded its prior approval of Advika and Simcor, two drugs that combine niacin with statins. Possible risks and side effects. While statins may be beneficial in cholesterol control, there are a few possible side effects. These include abdominal discomfort, constipation or diarrhea, dizziness, drowsiness, headaches, insomnia, nausea or vomiting, skin flushing, muscle weakness, memory loss. Such side effects are usually temporary when you first start the medication. Those at greatest risk for experiencing side effects from statins include people who are already taking other medications, people 65 years and older, people with small frames, and women. Having kidney or liver disease and drinking too much alcohol also increases your risk. Niacin carries the risk of overdose, which can cause the following complications: high blood sugar, infection, internal bleeding, liver damage, stroke, upset stomach. Meanwhile, another safety issue with niacin is that some supplements may be tainted with unknown ingredients. This can increase the risk for drug interaction, especially if you're taking other medications for cholesterol. Advice: lifestyle changes are certainly the preferred method for cholesterol control. The problem is that sometimes high cholesterol can't be lowered through healthy habits alone. Choosing between statins and niacin depends greatly on where your own levels stand, as well as the methods you have tried thus far. So, you should see changes within 2 to 4 weeks of taking statins or niacin. Alternative medications of statins and niacin. For those who aren't interested in taking statins or niacin or are unable to, there are a few alternative medications available. These include PCSK9 inhibitors. This medication works by inhibiting a protein called PCSK9, which regulates how the liver clears out cholesterol. By binding to the protein, lower cholesterol. This medication was effective in lowering cholesterol in several studies. Common side effects involved swelling or rash on the infection site, muscle pain, and in a small number of patients, eye problems. Around 1% of participants experienced memory impairment or confusion. Red yeast rice. Considered a natural medication, red yeast rice is a traditional Chinese medicine used to lower cholesterol. It contains several ingredients thought to help lower cholesterol, such as monocolin K. Monocolin K is a compound that is similar to lovastatin. Though natural, studies about red yeast rice's long-term safety have not been conducted, and the results are unclear. It's not currently approved by the FDA. It's not safe to stop taking statins for the sake of trying a more natural treatment. Make sure you do your research and discuss all methods of treatment with your doctor, both conventional and natural. Reference: The One Food Cholesterol Cure, 2 months free solution. Or visit 247naturalhealth.com to all chronic illness information. Link in the description. In particular, if you know Qigong and its miraculous improvements to health, visit falundafa.org. Thank you, I hope you are always happy and healthy. Thanks for watching. Don't forget to subscribe to the channel to receive useful information.